morning, dear student. Welcome in online classes of Buddha International School. Hope you all are fine and enjoying online classes. Dear student, as you know that we are discussing about role of government in healthcare, the chapter number 4 of civics. In this chapter mainly, in last lecture also you have seen that we have discussed the importance of health, that we have compared with the wealth also. No doubt, wealth is also very important, very necessary one. In present era, if wealth is not, then you know well that people are not going to consider our value even, and we also are going to feel like that we are nothing if money is not with us. But my dear student, you know well that the value of wealth is maybe, but the value of health is more than the wealth. Because if health is not then there is no value of wealth. So about the three dimension of health as per given by the WHO, that is physical, mental and social health, we have discussed, and I hope you got it properly. Today mainly we are going to discuss about the role of government in healthcare. You all know very well that whatever the healthcare facilities are there with us right now, the very great and important role is there of the government. Why it is there, my dear student? Because it is written in the constitution also that the first and foremost duty of the government is there to provide the healthcare facility to the people. Always work for the welfare of the people, and in welfare nation the first and important thing is there, that is healthcare facilities. Means to look into the health of the people, that how their health is going on, what kind of facilities, what kind of other requirement, what kind of instrument they require, these make them available there up to the people. These all the things are there, they look after by the government. So this is the duty of the government as per the constitution also. That's why, and even you know very well that if we are making the government by giving our vote, so we are going to accept more than the government, and our acceptation fulfilled by the government, then only that government will be stable for upcoming years. Otherwise that's not going to be stable for the long time. So simply, my dear student, that a government must be accountable for the people, especially to look after the health of the people by providing the different kind of medical and healthcare facility. In this regard, you all know well that education develops the mental outlook and capability of the person and kindles creative skill, while health tones up the physical ability and stamina. Education is also very important, you know very well. By education, our mental outlook and whatever the capabilities are there of a person, they can be kindles properly. We can kindle the different kind of creative skills also. While, my dear student, the health tone up physical ability and stamina. Our physical ability and our stamina, that is then only when we are healthy. So here, why this two line is there, that here the two thing is very important, education as well as health also. Here I am not comparing the health with the wealth. Here is what, that by education also our mental outlook and our capabilities of a person can be developed, my dear student. But the education is limited up to mental outlook and our capability only. But health is there, that is going to tone up our physical ability and stamina. So you see that how health is very important. That's why, my dear student, public health forms an important constituent of the social infrastructure. So the public health is there, that is going to form an important constituent of social infrastructure. That in society, whatever the social infrastructure is there, two things are very important. One is education and second is health. Then only that infrastructure can be developed, can be built properly, otherwise not. Next thing is there, in this regard, you know very well, Sir Joseph Bhore had established well-organized health service under the Health Survey and Department Committee in 1943. It's a very important question, that who had established the well-organized health service under the Health Survey and Department Committee. So my dear student, the name is what? Sir Joseph Bhore is there. He established in 1943. As you know very well that just after the independence, when we got independent in 1947, India was only one of the pioneer country which is going to focus more on the health programs of the people, that how their health is there, okay, by organizing different kinds of programs, by looking into the health of the people, by providing them the facility at the grassroots level also, so that you know that the people those are living, they can be come out from whatever the disease are there, and then they can you know contribute in the development of the nation. That's why from the beginning only, just after the independence, the India was the only country that is going to have the main focus on the health care of the people. Why? Because India know very well that if people are healthy, then only they can contribute in society, then only they can contribute in their family, in the nation only. If they are diseased one, if they are sick, they are not well, then the progress of the nation is not there. That's why from the beginning only, our government is trying to provide and trying to look the you know kind of health of the people, and so that they can be come out from such disease, from such sickness. In this regard, my dear student, the government had established a three-tier medical system. Especially, as you know well, that in all way our government is trying to provide the different kind of medical facility to the people, and that's why the government had established a three-tier medical system. Now, through this diagram, you can understand, my dear student, what the three-tier medical system is there. Number one is there, that is primary medical care system. Number two, secondary medical care system, and third one is tertiary medical care system. Again I am repeating, the government had established three-tier medical system. First one is primary, second is secondary medical, and third one is tertiary medical care system. Now one by one, my dear student, I am going to explain you that what is primary medical care, what is secondary, and what is tertiary medical care system. First you see the primary medical care system. This system provides a direct link between people and medical facilities at the grassroots level. Grassroots level means villages and towns. And primary healthcare centers, they are known as PHC also. They are known as a PHC, my dear student. They deal with the most giving and integrated promotive, preventive, curative and rehabilitative medical services to the people, and act as an instrument for the implementing all the government programs relating to health and family welfare. So in another way, I want to explain that what is PHC. PHC means primary medical care system. My dear student, you most of are from the rural areas only, and I think in your village also one hospital is there. You go through, you see it, there is written primary medical care system. Yeah, PHC. Prathmik Swasthya Kendra, maybe any one of the name you can find on that hospital, by which you can understand, my dear student, that this hospital is there, that is specially established by the government to provide the health facility at the grassroots level. Means the people those are living in towns and villages, they can get the better treatment on cheap prices without paying. You know well, just like in Rajasthan, the so many kind of diagnosis and as well as medical care facilities, medicines, and even whatever the kind of other things are there, they are free of cost. Only we have to pay 10 rupees for that kind of slip where the doctor is going to write something like medicines, whatever are there. Okay, but why it is so, my dear student? It is because of that only, that the government is trying to their best that whatever the people are living in rural areas, they can get the better facility, and that's why in each and every rural areas and town you will find one PHC there, that is primary healthcare system. Number one. Number two is there, my dear student, whatever the government facilities are there, maybe related to the birth of a girl child, related to birth of a boy child, yeah, any kind of other schemes are there for the old people, okay, senior citizens we can call them, yeah, any healthcare programs the government want to implement. First of all, that all kind of rehabilitative programs are there, they will implemented by the government through the primary medical care system only, that is PHC. Okay, so I hope that you understood that what is primary medical care system. Simply we can say a system of the government by which the rural areas can get the better health care and medical system. That is the kind of effort of the government by which every people, means the effort is there that they can reach up to every hamlet, up to village and town, that they no need to go far off village, far off city, as well as where it is very difficult for them to reach. And in emergency, it is very difficult, my dear students. Suppose in a village a kind of serious injury is there, or maybe any kind of other problem is there, but if PSC, then you can easily reach there by anyhow. But if you want to go in another, that is maybe 50 to 60 kilometers far from your village, that's very difficult to reach there. That's why it's one of the good effort of the government. Next, my dear student, that is what? CHC, okay, Community Health Care Center. Community Health Care Center, we can call it secondary medical care system also. What is CHC? You see, CHC, any community health care center, they also form a part of the primary level medical care system only. How? When the cases found most complicated by PHC are referred to CHC. Suppose if any complicated case is there, okay, and you went there in PHC, there the doctor examined properly, and after then they found it that yes, this case is somewhere complicated, this much facility are not there in PHC, so they are going to refer that case there in the CHC, that is Community Health Care Center. For example, suppose in any village, just like in Gudha, CHC is there, that is Community Health Care Center. So suppose in any village, any kind of serious injury, or maybe any kind of complication is there, any kind of complicated problem arises, then in that situation, if PHC is not able to deal properly, because the facilities are less, well, so they are going to refer that case to direct CHC to Community Health Care Center. Means in towns, we can say where the community health care centers are there, we can call CHC. And district hospitals, they are from the secondary medical care system. So you see, primary health care at the grassroots, means in villages, towns, we can say like CHC, community health care centers are there, and whatever the hospitals are there in district level, they are known as the secondary medical care system. And hospitals and institutions mean for the particular disease. The third one by the student, that is tertiary medical care system. So especially the hospital and institutions, they are meant for a particular disease. Specialized field by constitute tertiary medical care system or health infrastructure. Well, some hospitals are there, they are only for particular disease. Just like in Jaipur, Mahavir Cancer Hospital is there, S.V. Mittal Heart Hospital is there, Cancer Hospital there at Bhopal. Likewise, so many hospitals are there. You have. So that is, tertiary medical care system. So I hope the three-tier medical system of government you understood. Number one, primary medical care system at the villages. Second one is secondary medical care system at the district level, like CHC, in town like community healthcare centers are there. And third one is the tertiary medical care system, means the hospitals are there, those are specialized in some or other particular disease. They are meant for the particular disease only, known as tertiary medical care system. Except this, my dear student, the government is trying their best to providing the better healthcare facilities to the people. Why? Because you know very well that now, especially the main reason is there, that is communicable disease are there. So in this way, that by implementing different kinds of programs, by providing the different medical care facilities, by implementing them at the rural area, in town, in cities even, and our government is trying to fight with those diseases. Okay, communicable disease, you know very well that by communications that there is a kind of spread of those diseases there. They are known as the communicable disease. And communicable disease are a very big problem for the government. Why, my dear student? Because it's going to spread. And so when people are not aware, just like the corona is there, that is also the same kind of disease, we can say, that how it is going to spread. So without lack of knowledge, if people are there in contact of it, and then it's going to be spread, it's not going to be controlled, even then it may be a major issue for the government. So whatever the communicable diseases are there, for that also government try their best by providing the different healthcare facilities, by implementing them at the grassroots level, as well as at cities, as well as in towns also. And in this regard, the government is providing the facilities in two forms. Number one, that is public healthcare facilities, and number two, that is private healthcare facilities. So public healthcare facilities and private healthcare facilities, what is the difference, my dear student? Here I want to tell, and I know that you know well about this. Public healthcare facilities, provided by the government. So whatever the government hospitals are there, they are the good example of public healthcare facilities. These hospitals, public care facilities, public hospitals are there. They are government owned hospital. Whatever the government scheme, government policy, government programs are there, they are going to launch first through these hospitals only, so that everyone at the grassroots level can get the benefit of all the facilities, all the policies and all the programs of the government. Number two, my dear student, that public healthcare facilities through these hospitals, through the government hospitals, you know very well, maybe the facilities are little less facilities are there. Why? Because we are not paying anything there. That's why it is our mentality that in public healthcare hospitals, in public hospitals, simply we can say that somewhere the caring is not there, somewhere the facilities are very less even, and there is a kind of rush also. Then we can't get the proper kind of treatment also. But you have noticed one thing, my dear student, that in public healthcare facilities, everyone can get the treatment. Why? Because in some hospitals where the private hospitals are there, we can say they are going to charge very high fees. Okay, and it's very we can difficult, especially for the common man, common people. Some people are there BPL 1 below poverty line, then how they will get the treatment there? So simply, my dear students, it's a very good effort of the government that through the public healthcare facilities they try to provide the almost all kind of healthcare facilities to everyone, so they can get the better healthcare and better kind of facilities they can get through these all healthcare systems. Number two, my dear student, that is private healthcare facilities. Private healthcare facilities, private hospitals, they are provided by the individual or companies. Means owned by a individual company is there, kind of group of the people is there. They are going to run such hospital. They are known as a private healthcare facility or private hospitals. About private hospitals, I don't want to tell more. You know very well. There are so many big private hospitals are there. They are run by a company, either by a individual, and they are going to charge very high fees. Means it's not possible. It's not possible for a common man to get the treatment there in such hospitals. Why? Because if you are there for 1 to 3 days even, then they're going to charge very high amount from you. You have seen in newspaper also daily that a person got sick at a common kind of malaria and any other disease is there. The bill of the particular hospital is there beyond 1 lakh rupees. So definitely, my dear student, they will charge more. Why? Because number one, that the doctors are there, they are the retired doctors, so they are also going to charge the very high amount as their salary, so that the hospital is going to pay. Then in this way that they are going to extract that money from the individual, from the common man only, that is going to get the treatment there in those hospitals. So in private hospitals, somewhere you can say that facilities may be more. They are going to care personally more. Maybe the good nurses are there, some nursing care facilities are also fine. Okay, cleanness also we can say, because it's our mentality, because people are not going to care for the public. Wherever we are in the public hospital, we are going to spit here and there. We know that no one is going to watch us. But if you are doing the same activity in the private hospitals, you may find. But it's our somewhere carelessness. If we are fine, we are better than additional, we can develop the fine public healthcare facility also in a good way. But somehow we have to change this mentality. So in private healthcare facilities, my dear student, it is difficult to get the treatment, especially for the poor people. They cannot get the, why? Because the charges are very high. Caring, cleanness, we can say fine than the public, but the amount is the issue. So in the two way, my dear students, in public and private healthcare facility, they are also the kind of we can say facilities provided by the government, only for this that the people can get well and they can get the better medical, better healthcare system, so that they can develop and they can contribute in the nation. That's why you have seen that now in India you can see that the death rate is also very slow, and child mortality is also not there, infant carrying is also there. So many kind of if you will see in all way then you will find that really there is a great change, apparent change is there. Why? Because of the government initiatives. Why? Because of the government initiatives, that how by the 3-tier medical care system, and how by providing the facilities in two way, just like by private hospitals and by the public healthcare system. So I hope that the complete contribution of the government in healthcare programs and in healthcare facilities, in which way they are providing to us. I hope you understood. Even any doubt and any queries there, you feel free to discuss with me. Thank you. Have a nice day.